Hi, folks. So bring that out of the.
These structural problems, that it was creating extra work. And you know what, and I am.
Thank you for everyone for joining. This is Colonel Edwards. Just letting everyone know we will be getting started in 2 minutes.
No beep.
Okay, everyone, thank you for joining. I'm about to hand it over to Lieutenant Colonel Christopher Nason. Please, if you have not already done so, mute. Go on mute. Colonel Nason will go through a brief presentation, and then he will open up the town hall for questions to the public, and you can unmute yourselves at that point. Thank you.
Thank you, sir. I'm going to say a couple of things before we get started here. Thank you, everyone, for coming. My name is Captain Amanda Ramirez. I'm part of the Rhode Island Medical Detachment. Thank you so much for taking your time, and I'm admitting more and more people, which is great. I've recently been assigned here as a vaccine handler, part of Pod 1 here in Cranston, to help administer the COVID-19 Moderna vaccine, which we will begin on Monday, December 28th. I want to take a second to introduce Colonel Nason. He's of the Air Guard. He's the Chief of Aerospace Medicine at the 143rd, and he's also serves as the Medical Director at the Health Services Department at the University of Rhode Island. So he's an excellent resource. Again, I appreciate you taking your time to listen. Please make sure you're on mute. There is a chat function at the bottom. It might be a little bit different on your iPhone, but please feel free to send questions through the chat function. And after he has finished the presentation, I'll facilitate sending those questions to him if you don't feel comfortable talking over the phone or talking over the computer to him. So thank you again. And Colonel Nason, you can take it away.
All right, guys. I'm Chris Nason. I'm the medical director at the University of Rhode Island, and again, I'm the chief of aerospace medicine at the 143rd Air Wing. And I really want to thank you for taking a little bit of time out of your day and getting some education about the COVID-19 vaccination. There's nothing really more important right now to talk about than the vaccine, in my opinion, from a medical perspective. So just to start with a little bit of situational awareness of what things are like in our state at the moment. This is day number 400 in the world that the COVID-19 virus, since it's been identified. And it's day number 297 since the first case of COVID-19 was detected in Rhode Island. So we've been dealing with this pandemic for a while. And I know a lot of us are starting to feel fatigue, or many of us are feeling fatigue. You know, this is a marathon, not a sprint. So, but I think this vaccine is finally the light at the end of the tunnel and will get us out of this situation. In the US thus far, there's been north of 17 million cases to date, with over 300,000 deaths. In Rhode Island, there's been over 77,000 cases with over 1,600 deaths. Rhode Island has a couple significant risk factors during the pandemic. One is we have the third highest population density in the United States. That serves to help with the spread of the virus. And we're the 14th highest percentage of senior citizens per capita. And those are, of course, the seniors are at highest risk for mortality from the disease. This together has led to us having the fourth highest mortality rate per capita in our nursing homes. Rhode Island hospital systems are currently at capacity, and resulting in the opening of 2 field hospitals earlier this month. So things are fairly dire from a medical standpoint. You know, trying to put, the deaths from COVID-19 into perspective. COVID-19 now has surpassed heart disease as the leading cause of death in the US. Recently, more people die of COVID-19 each day than died in the 9/11 terrorist attacks or during the bombing of Pearl Harbor. And more people have died thus far in the pandemic, more than the number of Americans who died in World War II. So it's really wreaking havoc on our country. And, Benjamin Franklin coined the phrase over 230 years ago that prevention is worth a pound of cure, and nothing is more true at the moment. The vaccination is probably our greatest tool for prevention going forward for the pandemic. Using therapeutics or the cure, if you will, that's not working so well. It doesn't work well at all, particularly when our hospital systems are overwhelmed. So the vaccination is really crucial right now. And 2020 has been a challenging year, but what a great year for the Guard. I mean, it's really been the year of the National Guard. I mean, we've really stepped up and done so many things across the country, the response to the COVID-19 pandemic, fighting fires. We've done all kinds of stuff, and all the normal stuff that we do overseas. So this is a real opportunity for citizen soldiers to once again step up and help with the vaccination effort. I'd like to take a minute and talk about sort of how vaccines work. There's really sort of 2 components to create the immune response. There's the antigen, which is the germ, and there's the antibody, which is the piece of our immune system that responds to the germ and it gives us protection going forward. And if you look at this cartoon, all of us listening to this presentation right now, we all have antibodies against measles and the flu and chickenpox, because either we've had the vaccinations in our life or we've had the disease. But when a new pathogen comes around, like COVID-19, the problem is we have no antibodies. And without the antibodies, we don't have protection. And if we're exposed to the disease, we could have some really serious outcomes. The good news is this does give us an opportunity. And this is where I think we're going to have a lot of success going forward. Now, traditionally, vaccines have been one of 2 types, either a killed vaccine or a live vaccine. You've probably heard those terms before. A killed vaccine, in simple terms, is just chopping up the virus or the pathogen and injecting that into the body. The body sees that it's foreign, creates an antibody, and then we go forward with some immunity to the pathogen. A live vaccine is when we take the virus or the pathogen and we attenuate it. That is, we render it so it can't hurt people, and then we inject that into the person to create the immune response. That's traditionally how we've worked with vaccines up till now. I think really, I can't tell you how excited I am that we're now using nanomedicine to kind of combat the COVID-19 virus through a vaccine. And, this nanomedicine and messenger RNA I'll talk about here in just a minute is really a quantum leap in our knowledge, our medical knowledge, and likely will revolutionize the way we treat illness going forward. So these are really exciting times. I mean, this is definitely a silver lining that's come out of the pandemic. Essentially what happens with messenger RNA vaccines is messenger RNA is essentially a recipe for a protein. And scientists have determined the recipe to create a protein that looks like the spike protein on the COVID-19 virus. And what they do is they put that in a fatty envelope. We inject that. The cell takes up the messenger RNA, and that messenger RNA basically is taken into the cell and finds its way into the ribosomes, which are essentially like the manufacturing plants of our cells. And the ribosomes spit out proteins that look like the COVID-19 spike protein. And those are excreted outside the cell. Our white blood cells, our immune cells respond to that and create antibodies. And that's how it works. Now, I know a lot of people have been afraid that, oh gosh, is this going to alter my DNA in any way? And the answer is no. It has no interaction with DNA at all. It's going back to sort of high school cell biology. The messenger RNA stays in the cytoplasm or the extranuclear part of the cell, so it never interferes with our DNA. And the messenger RNA doesn't last long. It's fairly fleeting. So after a day or two, it's gone. And people wonder, well, this is new technology. What's going to happen down the road? Like, is this going to create any problems? And what I can tell you is the scientist who came up with the recipe for this messenger RNA has been using this technology in cancer therapeutics for over 2 decades now. And, we're using this technology on the sickest of patients, and they're doing great. They haven't had any problems. So I don't think there's going to be any problems down the road by using messenger RNA. So that's really good news. And like I said, it's likely that this will revolutionize the way we treat illness. With cancer, they can literally take a piece of someone's tumor. They can find out a protein identified on that tumor, create the messenger RNA, inject the person, they create antibodies, and it basically targets the tumor. It's a very elegant approach to fighting disease. Well, let's fast forward for a minute and talk about Operation Warp Speed. This has been really unprecedented. It's been fast and it's been safe. In Operation Warp Speed, as many of you know, is basically a federally funded program that sunk over $2.5 billion into buying raw materials, expanding factory capacity, and increasing vaccine workforce by over 50%. And I think some of our scientists, our national scientists, took a little bit of a bet, and they basically started manufacturing these vaccines very early in the stages before we know if they would work or not. That was a little bit of a gamble, but boy, did that pay off. These are going to really pay off in spades. So let me talk about how vaccines are usually produced. There's a system that they have to go through. In phase 1, basically the vaccine is given to human subjects, and we make sure that it's safe and it doesn't cause any harm to the person. That's the shortest phase. Phase 2 is we inject the vaccine to a person, and we make sure that they have an immune response to the vaccine. And then phase 3, which is the largest part of the study and takes generally the longest, is basically vaccinating one group with a vaccine and another group of equal size with a placebo, and seeing if the vaccine actually protects people against the disease. Now, phase 3 usually takes a while because the prevalence of diseases is really fairly low for many diseases. But because we were basically creating this vaccination during the height of a pandemic, the prevalence of the disease is really high, and that really greatly accelerated the timeline on phase 3. No vaccine safeguards were eliminated during the process. The FDA is a very strict body, and everything was done by the book. And really, the FDA supports these vaccines with a favorable safety profile. And it's unbelievable that both the Moderna and the Pfizer vaccinations have a 95% efficacy rate. That's really unbelievable. So in 95% of the time, they're going to basically block the disease. And even in that small 5%, if you get the disease, it's likely going to be a very mild course of the disease. So this is really, really favorable news. I'm going to take a minute and talk about the so-called grade 3 side effects. I mean, these have been getting a lot of popular press if you watch the news, the papers. And what a grade 3 side effect is it's severe enough to make the person, either take some Tylenol or ibuprofen, or maybe even miss a day of work because you feel pretty crummy. That's kind of my definition of a grade 3 side effect. It's not harmful in any way, but it's uncomfortable. And, they've been, fairly high with these vaccines. I mean, 1 in 10 may have, muscle aches or fatigue. 1 in 20 might have headache, to a lesser degree, fever, chills. So, we're going to expect some of these side effects with this vaccination, and again, they're not dangerous in any way, but they can be uncomfortable. And generally these happen after the second dose of the vaccine. These side effects are basically the immune system showing that it's having a healthy response to the vaccination. It's revving up your immune system. When your immune system is stimulated, that's what causes these symptoms. So when you get an illness, like let's say last year if you had the flu, it's not the virus that's causing fever and muscle aches. It's actually your immune response to the pathogen. Patients, as a family doctor, I'm constantly reassuring people that, the flu shot does not cause the flu. That's impossible. What can happen though is the flu shot can stimulate the immune system, which can cause some flu-like symptoms. So that's where these side effects come into play. So not dangerous, but could be uncomfortable for a day or two. One thing to note though is if service members have cough, shortness of breath, loss of taste or smell, these would not be expected from the COVID-19 vaccination. If you were to develop symptoms like that after the vaccination, I want you to call the aid station or public health because it may be that you need to get tested for COVID-19. There are some logistical concerns with the vaccinations. As many of us know, there's going to be a tiered approach to the deployment of the vaccine, and this is by risk stratification. So I think all of us would agree, probably the people that need to get it first would be elderly folks in congregate care settings and healthcare workers who are on the front lines, particularly in the hospitals. Without the hospitals functioning, we can't take care of the sickest people. The Pfizer vaccination requires an ultra cold storage of minus 94 degrees Fahrenheit. So that's a logistical concern. There is some good news here though. There are no preservatives that are required for this vaccine. I know a lot of people are concerned when there's preservatives in vaccines, but there are no preservatives in either the Moderna or the Pfizer vaccination. Both vaccines require a second booster dose, either a day 21 or 28, depending on which vaccine you're using. And the booster dose has to be the same as the initial dose. You can't mix the two. So those are just some other logistical concerns. All right, a reminder, I feel like a broken record. I tell people this every single day, but wear your mask, socially distance yourself, wash your hands. These things are still incredibly important and going to continue to be incredibly important for some more time. We'll eventually get to the point where we can kind of lower our guard, but we're certainly not there yet. But hopefully with this vaccination, we'll get there. But for now, we have to keep doing the same thing. Now, the COVID-19 vaccine is incredibly good at preventing the disease, but it may not be as good at preventing people from spreading the disease. So I get vaccinated, I might be exposed to COVID-19. I don't develop any symptoms, but I can still shed a little bit of the virus if I'm exposed. That concern is still there. So we still have to be really careful and watch our guard there. Data thus far suggests that 7 to 10 days after the second dose, the booster dose, you'll have optimal immunity against the COVID-19 virus. But some evidence shows that there may be some immunity even after the first dose, which is really good news. And long-term immunity data is still not available, but from data thus far that we have, subjects still have really good immunity and antibody titers more than 90 days out now from their vaccination. So, as a physician, I see the COVID-19 vaccine as truly an end a light at the end of the tunnel. You know, we've been sort of painted in this corner, and this is finally we're given a way out. So I'm really excited about this. I'm excited about how we as soldier citizens can really help in this effort. This is good stuff. We'll make sure that these slides are available for public consumption. I have a couple links here. These are just for FAQs at the CDC and the Rhode websites about the vaccine. But certainly we're going to open it up now to see if there's any questions from the audience that I can answer during the town hall meeting.
Colonel, this is Tech Sergeant Pemberty. How are you?
I'm well, John. How are you?
Good, good. Quick question. So now that we're going to start getting our vaccines, right now it's not mandatory, but let's say a service member travels, he already has the vaccine, comes back from a red state. Do we still quarantine the member? Will we still follow the same procedures?
That's actually a really good question, John, and that's kind of a gray area. That's actually similar to having been infected and you need to quarantine for the 90 days after an infection. The answer eventually is going to be likely no, that you won't require a quarantine. But I'm sure that people will set up their own policies and procedures for that. But no, once you are fully vaccinated, so 10 days beyond that second dose of the vaccine, you should have good immunity and you shouldn't have to quarantine after that point.
So it also goes on for the people that do get, let's say, but you mentioned it about people getting sick. Now we have to pay attention to their symptoms because you said if they are having the symptoms of loss of taste, difficult breathing, yes, go get tested. But if a service member that already had the vaccine is exposing just fatigue or a minor headache, do you recommend them to just stay home, or do you want us to have them get tested again for COVID?
Yeah, that's a great question. And at some point, John, that's going to be case by case. But what I would say is this: it's very likely that if you're having a single symptom after, the day or two after a vaccine, let's say I have just a headache or I feel excessively fatigued or I have a sore arm, it's likely that those are just from the vaccination, not from COVID. So I think it's safe for the service member to stay out of work, until they feel well enough to come back. But if they're having multiple symptoms or they're having some of those alarm symptoms that we mentioned previously, they're really going to have to call you at public health or call the Army aid station to talk to a provider and get tested.
Thank you, sir.
Sean, you can go ahead and pose your question.
Hey, sir, it's Chief Ballard. My question just has to do with like a DNF status or a work status in general. Are there any limitations as soon as you take the vaccine?
That's a great question, Chief. I would say that that as long we should probably anticipate people, particularly after that second dose, having some side effects. I certainly wouldn't recommend scheduling people to fly in the day or two after the second dose, just because it's likely that they'll have a sore arm or a headache or just feel fatigued. It's probably just not a good idea. I don't think it's going to be automatically DNFing them.
Okay, thank you. Appreciate it.
Good afternoon, sir. How are you? This is Tech Sergeant Tavares.
Hey, Sergeant Tavares, how are you?
Good, and yourself, sir. And I apologize if maybe I missed it because I know that it's a lot of information to kind of take in. So I keep hearing you say that there is 2 doses. So how much time in between from the first time you get the vaccine to the second dose?
That's a good question, and it depends on which vaccine you get. It's one of the vaccines is going to be 21 days, so 3 weeks between the 2 doses, and the other is going to be 28 days. So, and you can't interchange them. So, for example, if you get the Moderna vaccine, you can't get the Pfizer as the booster, and vice versa. Okay, so you have to stick with that timeline, whatever you get as an initial vaccine. But it's either going to be 3 or 4 weeks.
4 weeks. Okay. And then, so let's say that I get my first one and then I'm going to travel out of the country. Is that going to be a problem in me coming back to getting that second dose, or is it preferably to try to get both before, leaving the country?
No, that's a great question. So the way we deal with that with the vaccines is you can get the second booster dose beyond that time frame. That's never going to be a problem. You just can't get it before that. So if you go, let's say you're out of the country for, I don't know, a couple of months, you could come back and get that booster at that time. But just know you won't have optimal immunity until you get that booster dose.
Second one. Copy, sir. Do we know when we're going to start getting them yet? Us service members?
Yep, I believe Sergeant Ramirez may have that information.
Okay,
I'll let her speak to that.
Okay, awesome. Thank you so much, sir. I appreciate it.
You bet.
Hi, Tech Sergeant Tavares. This is Colonel Edwards. So service members currently on 502F orders, Title 32 502F. The vaccination window, we will be getting Moderna. We have been given authority to use the Moderna vaccine, which is the 28 days. And we are starting on service members on 502F on the 28th of December. So your chain of command should be contacting you to determine if you want to receive it, and there's an opt-in form, as well as a date and time to schedule it. For service members not currently on 502F orders, that will be a time frame yet to be determined. It's going to be determined by how long it takes us to get all the 502F service members, which is the initial authorization, and then possibly opening it up to service members either on various AGR status, M-Day service members, and things like that. So more information will be forthcoming if you are not on Title 32 502F.
Perfect, sir. Thank you so much for the information. I appreciate it.
General Chevalier.
Thanks for, can you hear me?
Yes, sir.
Okay. First of all, just let me say great presentation and great job by the team leaning forward. It is really, it's an awesome feeling when you see everyone come together like this to support the bigger team, if you will. I would encourage everyone at this point, it is an opt-in, but I do encourage everyone to get the vaccine, because really it comes down to readiness and our ability to be ready to continue to fight COVID, and then also be ready for our federal mission. So, and it is, the efficacy and the safety of this vaccine is probably at or above or better than that of the common flu vaccine. So that's what the medical professionals are suggesting at this point. The one question that I have is, and forgive me if you did cover this, but if you've already been COVID positive, would you go ahead and get the vaccine anyway? So.
Yeah, sir, thanks for asking that question. I should have mentioned that before. Yes, if you've had the virus already, you should get the vaccine. And the reason is there's different strains of the virus that are going on right now. There's a different strain in Europe that's been making a lot of press this week. And there are a lot of documented cases of reinfection, sometimes even worse than the first infection. So I would highly recommend the vaccine, even if you've had the infection in the past.
Thank you.
So, Chris, I'm going to read some of the questions that have been showing up both on the Facebook live stream as well as the chat window. One question is, why get a vaccination for something that has a 99.9% survival rate?
Right. So that's the question of being a good steward for our community. It's true that a lot of particularly young adults, aren't as severely affected by the COVID-19 virus. But when we're not vaccinated, we're not preventing disease to spread to our fellow citizens. It's ultimately leading to a lot of deaths. Like I had said in the slide, I mean, if we start to look at how many people have died thus far, and we're just hitting the peak now, it's a lot of people. So even though if you look at, gosh, it's, only 1 in 200 will pass away. That's a lot of people. So, and really to get the herd immunity, we all need to do our part to get vaccinated to protect our communities. So it really is the right thing to do, not just for personal protection, but for force protection, and again, being a good citizen and protecting our community.
Colonel Nason, another question from the group. Are there any concerns for those who have mild or moderate food allergies having an anaphylactic reaction to the vaccine?
Yeah, that's a great question. So one of the few contraindications to the vaccine is if you've had an anaphylactic reaction to a vaccination in the past, not a food allergy, but a vaccination. And so there's always a risk of allergy. Whenever we take something that's not part of our body and we put it in, there could be an allergic reaction. It's not very common, but it has been noted, particularly in Britain with the vaccination effort. So that is a risk, but right now we're just saying, unless you've had a really severe anaphylactic allergic reaction in the past, the vaccine should be safe.
Chris, another question that's being asked, why are there 2 different types of the vaccine?
Yeah, so that's private sector stuff. So competition. So, interestingly, the 2 choices that we have were being, basically they were started at about the same time. 2 really smart, BioNTech from Germany and Moderna at Cambridge. They started the technology, they're using the same technology. And even though it's not exactly the same, it's incredibly similar. They're using essentially the same messenger RNA to simulate that spike protein response. So, and it's just a matter of, where we can get the vaccine from. Personally, I can tell you that to me, I'll get the first one that's offered to me. They're both incredibly safe and they're both incredibly similar.
So a very good question that was just written on the post. Will the vaccine prevent COVID from all strains, even if it continues to mutate?
At this point, as far as we know, yes. Again, we've all been living in the pandemic, and there's, you can never know everything for sure. But at this point, I think that this vaccination will prevent against various strains of COVID-19. That's a great question. And again, a big concern because another strain's been sort of ravaging Europe right now. So yeah, it's going to be really important.
Tom, you can go ahead and ask your question.
Nobody's got a question.
So kind of going up, someone asked if this is being recorded and will it be available? Yes, this is being recorded and this is going to be shared broadly through PAO channels. I believe it's going to be going on the Rhode Island National Guard Facebook page, but it will be widely available for viewing later on. Yes.
Dr. Nason, another question regarding allergies again, but specific to sulfa medications. Are you aware of any allergic reactions to those who have a prior history of allergies to sulfur medications? And is it safe to take the vaccine?
Yes, I would say with any medicinal allergy, it should be safe to take the vaccine. Again, it's really more if you've had anaphylaxis, which is a life-threatening allergic reaction, either a vaccine or some other allergy that people have anaphylaxis to, that would be a concern to get the vaccine. But your standard drug allergy is no factor. You should be able to get that safely.
Sir, this is Tech Sergeant Wells from the maintenance group. I have a question regarding fertility. There have been lots of rumors going around that this vaccine causes infertility. Are there any cases or is there any information out there proving whether this is true or not?
Yes, I can say that is not true. I can give that a hard no. I think where some of the confusion might come from is it safe during pregnancy and lactation? And the answer is we think it is, but it hasn't been studied enough in that subgroup so the recommendation is now is if you're pregnant or lactating, if you're at high risk, let's say you're a first responder or something of that nature, we're recommending that folks who are pregnant or lactating go ahead and get the vaccine. But because the subgroup hasn't been studied a lot right now, there's not a broad indication for that group as of yet. But no, it's not going to cause infertility.
Thank you, sir.
There's been multiple questions about, again, are DoD civilians eligible for vaccination? When will service members be getting it? So again, everyone will be eligible for this vaccine at certain points. The initial phase that we're in, which is phase 1 alpha, is very specific to frontline healthcare workers, core infrastructure, and responders, which is what the DoD has categorized people in a Title 32 502F status, which is why this is the initial rollout for service members on Title 32 502F. But service members not activated under Title 32 in technicians, DoD civilians, all will be eligible to get this vaccine at some point in the coming weeks or months. Very, very good question was just posed, Chris. Is there a timeline for approval of a vaccine schedule for children?
Well, that's a good question. So if I recall, the Pfizer vaccine is indicated for people age 16 and up, and Moderna is 18 and up. Again, that has to do with the phase 3 trial. Those age groups haven't been studied yet. So I expect as we go forward, they're going to do more studies to make sure that it's safe and efficacious in younger people. But for right now, it's 16 and up and 18 and up, depending on the vaccine you get.
That's the majority of the questions that I'm seeing. Oh, another one, Chris. Recommendation of vaccination in a person with angioedema reaction in the past. Do you recommend they get this vaccine?
If they've had angioedema to a vaccine, I would say you probably pull. If they've had angioedema in the distant past and they've been safe with other vaccines, I wouldn't have a concern.
One more question, sir. At the time of vaccination, if a service member has mild to moderate flu-like symptoms, do we still receive the vaccine, or should the member wait until symptoms have resolved?
Well, that's actually a great question. So the way we usually do it, I would use the same strategy as flu vaccination. So if you're having fever, we should wait to give you the vaccine until the fever is gone. And the reason that is your immune system's already revved up, and if you give a vaccine, it's going to be less efficacious. So you may delay that vaccination by 5 to 7 days until that fever resolves. But if you have a mild illness, non-COVID, and you're afebrile, not having a fever, it's safe to get the vaccine. Another piece would be if the person is recently took some steroids, like, for example, they have asthma or something like that, and they took some steroids. Steroids are immune suppressant, so they'll basically affect how efficacious the vaccine is. So we generally wait till that medication is out of the bloodstream.
Chris, will the vaccine be yearly similar to how we do influenza?
That's a $1 million question. We don't know. I hope not, but that's possible.
Sir, I have one more question. Sorry, Sergeant Tavares again. So, I know you mentioned that for kids, not yet. What about like those kids that have underlying conditions? And obviously, right now, they're probably more susceptible to the virus, or any kids, with special needs or things like that would get them.
That's a great question. And I think the answer to that question is as soon as we can better study those age groups and make sure it's safe in children and tweens, then we can start giving it. And those children with the medical comorbidities will obviously be in the highest tier to get the vaccine. But right now, we still have to study it in children just to make sure it's okay.
Perfect. Thank you very much, sir.
Another
Hi, Colonel.
question.
This is sorry. Go ahead.
Nope.
Okay, thank you. Sorry, sir. It's Sergeant Colella. I had a question, more so for the people that were COVID positive. Does the members' immunity response stronger if they were COVID positive versus receiving the vaccine? And how long does that last compared to the vaccine?
That's a great question, Steve, and we'll have to see. We do know that getting the vaccine after a COVID infection will give you more optimal and prolonged immunity. So that's number one. That's really important. But how that's going to differ from someone who's never had the disease before the vaccination, we're just going to have to wait and see.
I see. Okay. Thank you, sir.
So here's a very good question that was just posed. So if a person experiences COVID-like symptoms shortly after getting the vaccine, should they isolate per current guidelines? And would you recommend that people isolate for a certain number of days after getting vaccinated?
Yeah, so that's a great question. This is going to be something that we're going to have pay a lot of attention to. So I would say this: anyone with a significant symptom after the vaccination should really call the Rna station or the Air Guard Public Health Department. And here's why. We're going to have to do this case by case. As a physician, if you're telling me you have a single symptom after the vaccine, and that's a typical symptom of the vaccine, I'm likely going to say, listen, just isolate from work until you're feeling better. And when you feel better, come back to work. If you have several symptoms or you have symptoms that aren't, congruent with what we'd expect from the vaccination, then you're going to need to isolate and get tested, just like we do now.
Yeah, and to kind of piggyback, so some of the telltale symptoms of COVID-19, right? The loss of taste or smell.
Right. So cough, shortness of breath, loss of taste or smell, those would not be anticipated after the vaccination. So anything like that, you should immediately self-isolate yourself, call the aid station or public health and get tested. Very, very important.
Colonel, Sergeant Colella, again, I just wanted to ask another question. After a member gets vaccinated, that doesn't mean they're no longer infectious towards other people, correct? They can still spread the COVID-19. It's just that their immune response will not be as strong as if someone didn't get the vaccine. Right.
So that's a really good question. And to answer that, the vaccine really primarily its job is to basically prevent the disease. But after vaccination, if you're exposed to COVID-19, you could still potentially spread that disease. Now, as we go forward, we're going to learn more and more about that. A lot of people think that after vaccination, you're less likely to spread even if you're exposed, but we'll have more data in probably 3 to 6 months.
Copy. Thank you.
General Chevalier.
This one's actually for Lieutenant Colonel Edwards or Colonel Kentley. Especially for these initial 600 doses of 600, when a soldier or airman gets vaccinated, are they going to automatically schedule them for the follow-on test, or is that going to be something that they have to schedule themselves?
Yes, sir. So for these initial 600 doses, they will. So when they arrive for their initial dose, we will automatically schedule them for an appointment for their second dose 28 days later. That's so when they get back to their unit, if they determine, no, we need them on whatever that 28th day is, they can reschedule that later on. But every service member that comes through to get their initial dose will leave here with a second appointment to get their follow-on dose. Yes, sir.
Thank you.
Colonel Nason, another question from the group. How long do the side effects post-vaccine typically last? And what about the facial droop side effect?
Yeah, great question, Amanda. I'd expect the side effects from the grade 3 side effects from the vaccine to last only 1 or 2 days. If it's going beyond 2 days, I think you really need to pick up the phone and call a health professional to make sure it's really a side effect or if it's illness. The second question is interesting. It's been in the news. Is Bell's palsy the facial paralysis that came, I believe, from the Moderna study. They found 30,000 people that they vaccinated. 4 people had Bell's palsy. To put that in perspective, Bell's palsy, we see about 35 cases per 100,000 individuals. So that's pretty much in line with what we would normally see for prevalence of Bell's palsy. So there's no indication that there's cause and effect there, but the FDA is tracking that just to make sure.
So there is a question, will the vaccine be mandatory for service members? So at this time, the EUA, emergency use authorization, is very specific. The vaccine is not mandatory for anyone at this point. Whether or not the DoD will mandate it at some point in the future is somewhat nebulous right now. I don't have an answer to that, but I do know it is not mandatory at this particular juncture in time. I'm not seeing any other questions coming from the chat. Are there any other individuals who would like to open up their mics and ask any questions of Dr. Nason or anyone else on the panel?
Dr. Sergeant Ramian from Security.
Hey, Sergeant, how are you?
Good. I have an elderly member of my family with a autoimmunodeficiency, and they were curious if the vaccine is as effective.
That's a great question. Certainly, they're in need of the vaccine. We want to really protect that subgroup of people because they're a higher risk of having a bad outcome. But the problem is when you have kind of problems with your immunity, the vaccinations don't take always as well. But I'm hoping with that booster shot, it's really it'll surpass that deficiency and it'll get them protected.
Great. Thank you, sir.
So just briefly, another one came in. Whether past medical history or specific contraindications, what specifically they are for Moderna, kind of concentrate on Moderna at this point.
The only contraindication that I'm aware is if you've had an anaphylactic reaction to a previous vaccination of any kind. That would be a contraindication. Other than that, we're telling people to get vaccinated.
Hello, this is Lieutenant Colonel McGordy.
Hey, Mike.
Hey, I just have a quick question. I haven't been asked this yet, but it's going to happen, I'm sure. If somebody does inadvertently get vaccinated once and then the second vaccination is with a different vaccine, are we aware of any kind of harmful effects from that?
That's a great question. What happens, what can happen in medicine is that, the wrong amount of the vaccine is given to an individual or they get the wrong vaccine. That shouldn't cause any harm. What I would recommend in a situation like that is I would probably have a waiting period after that second erroneous dose, and then I would booster them with the appropriate.
Oh, you got. So you get 3 shots.
Yeah, you get 3.
All right, great. Thanks for doing this too, Chris. This is great, and everybody involved. This is very helpful. Thank you for your time.
Any other questions from the field for either Dr. Nason, or the leadership of the panel.
Yeah, sorry, just quick question. And I don't know if on the slides they were listed, but what are like all the possible, I guess, side effects that this could possibly have?
So I'll go back to the slide, Sergeant Tavares.
Okay.
So the most common things that you're going to see for side effects are going to be muscle aches, feeling tired, having a headache, fever, chills, maybe a little bit of nausea. Those are going to be the most common things, and a sore arm as well. And these actually are very similar to other vaccinations. This is really not very different than other vaccinations. This is that the rates are a little bit higher with this COVID-19 vaccine, just because, again, it really is incredibly efficient at really promoting that immune response, which is ultimately what keeps us safe. So I see this as almost a good thing.
Thank you very much.
There is one more question that just popped up, and it was briefly mentioned earlier, but we'll just kind of reemphasize it. What happens if someone missed their second dose or couldn't make it to their dose for the 28th day?
Yeah, that's no problem. You can get it beyond that. Beyond the 28 days, you can get the second dose. You just shouldn't get it before the 28 days. And so this is going to happen, frequently. For example, if the vaccination center is not open on weekends, the 28th day falls on a Saturday, no problem. You get it on Monday. Not a big deal at all.
Sir,
Hey,
I
so,
have one. Oh, sorry.
Sorry, I stepped on you there. So this is Sergeant DeSalvo from Ops. How are you?
Hey, how are you?
Good. My only question is, can you speak more in terms of the approval process for the vaccine, in terms of safety? Is there any reason to wait to see sort of how the vaccine plays out as it gets rolled out, or is it like, can you just speak more to is it safe to take right now, do you think, or is there any reason to wait?
Yeah, that's a great question. I'm glad you asked that, Sergeant Salvo. It's a really good one. So the way this works is the FDA is sort of the approval authority. But before it gets to the FDA, there's an independent panel of scientists who actually really go down and delve down into the data. And they really look at this, and they're very, very, very strict. These things are really controlled. So if there's any thought that there could be a potential for harm, they're not going to approve this. So, I feel very comfortable telling people it is safe to get now. If the FDA is giving an EUA for this to be deployed, you can rest assured that it's safe.
Thank you.
Sorry, sir. It's Sergeant Wells again. I was just wondering if you could just kind of touch again on the length of time that the vaccination, for lack of a better way of putting it, makes you immune to the virus. I understand you could still spread the virus, but as far as getting sick yourself, what's the length of time that you could stay immune to getting the virus with the vaccine before needing another booster?
That's a great question, Sergeant Wells, and thanks for asking it. The answer is no one really knows for sure. I mean, we're hoping it's 2 shots and done, but we'll have to see what people's immunity does, after the vaccination. All I can do at this point is 90 days out. The first people that were vaccinated in the studies have really robust immune response still, so that's good news. But will we have to get an annual booster? That's going to depend on what the research is. That's what happens with the COVID-19 pandemic. What we're hoping is with herd immunity, it'll just burn out and go away, and we won't have to worry about it anymore. But if COVID-19 continues to be a factor, we'll have to revisit how long our immunity will last. I wish I could answer that question, but no one knows, not even Dr. Fauci.
Thank you, sir.
So I think that is most of the questions. And I do just want to put out, as we're recording this and it's going to be widely available, if there are additional questions specific to the vaccine, Major Mark Patrick is the medical director for Task Force Vaccine. He is available to answer any follow-on questions. as is Sergeant First Class Lavoie, who's the NCOIC for this task force. And there is a dedicated phone line that has been put out in the Frago, and that we will also put out again. So if there are follow-on questions to that, either of those two individuals can be reached at any time to answer them, either if you're needing information to determine whether you're going to opt in to receive it, or if you've received the vaccine and have follow-on questions after receiving it. Aside from that, I just want to thank Colonel Nason again for taking the time out. This is incredibly beneficial, and we're hoping that this is kind of assuage some of the fears that I know are out there for individuals, and that will be the catalyst to more individuals within the National Guard getting this vaccine, which is the best option we have towards that goal of herd immunity sometime in the very near future. So thank you, Dr. Nason. Captain Ramirez.
Matt, can I make one comment?
Yes, absolutely.
Real quick, I want to thank people for spending some time and listening. You know, again, I can't think of a more important thing to do right now than get vaccinated, and I really appreciate this time. And as we head into the holidays here, I know it's a tough time for many, but I want to share one more anecdote with service members who might be on the call with young children, and that is, I read in the newspaper this morning that Dr. Fauci went up to the North Pole and gave Santa Claus the COVID-19 vaccine. And the good news is Santa Claus had a great immune response and is now immune to COVID-19. So he'll be delivering toys as on schedule and as he should.
Excellent news. Thanks, Chris. I appreciate it. General Chevalier or any of the other leadership have any final comments?
I just want to echo the comments. Thank you all for participating in the call. It's an important thing, and please don't let the message stop here. Spread it amongst your peers, and if you get a hold of the recording of this, push it out to your peers, because it's really important to reach that herd immunity level. So thank you.
Excellent. Thank you, sir. So that's it for the town hall. Again, this is being recorded, and it will be put on the National Guard Facebook page, and it will be widely distributed for mass education of the force on the Moderna COVID-19 vaccine that should arrive in the state tomorrow. And Task Force Vax will be getting our vaccines very soon. And then on the 28th of December, the rest of the force on 502F will be initiating those who opt in. Thank you very much.